Thank you for coming on today, Philip.
Okay, thank you, Saeed, and thanks to your team for inviting me to talk to you today. So I'm Philip. I'm a consultant gastroenterologist at the Royal Liverpool Hospital, and I specialise in looking after people with inflammatory bowel disease in particular, but also patients with intestinal failure and also transition patients that move from paediatric to adult care. They're my main areas of expertise.
Sounds very interesting and must have taken a lot of training to get there, uh, especially consultant level. Must have been many years in medical school, right?
Yeah, no, I mean, I started at medical school in 1999 in
Okay.
Nottingham, not far from where you are in Leicester,
Hmm.
Saeed.
Okay,
Um,
yeah.
and we did 5 years at Nottingham where you get an intercalculated degree as well as your medical degree.
Yeah.
And then did my what we would call PRHO jobs in Liverpool in the Merseyside region in 2004, 2005. And then we moved down to London, my wife and I, to do our SHO jobs, what you would call our core medical training jobs.
Okay.
And then registrar jobs in London. And then because of a number of different reasons, we moved back up to Liverpool. My wife works at Alder Hay Children's Hospital and I work at the Royal Liverpool. So we've moved around. But it all started out back in 1999.
Wow. So a very long time ago. But you do look quite young, so not too bad.
I'm 40
Um,
this year.
right. If you don't mind, we'd like to take you back all the way to 1999 and maybe just before that, as most people know, getting into medical school is quite hard. So we would like to know about your sort of background when it came to applying for medicine. Did you feel like your background helped you, or do you feel like there was a few obstacles that you had to get past to get into medicine?
Yeah, good question. So my background is that my dad's both my mum and dad are from working class backgrounds in Manchester. My dad worked in an abattoir, worked in the meat trade, the meat
Okay.
business, and my mum, after working in the NHS for a brief period of time as a medical secretary, then was a stay-at-home mum, but then became a home care over periods of time. So it's from a very ordinary non-medical background. Nobody in my family was medical, and in fact, my parents hadn't been to university or anything like that. Went to a comprehensive school in Rochdale called Saint Cuthbert's. So it wasn't a particularly fancy school. And in my sixth form, there wasn't an aspiration at all to do medicine. Nobody had ever applied. Some people weren't planning on going to university somewhere, and there certainly wasn't an aspiration to do any course like medicine
Hmm.
at my school. So it was a very ordinary background, a working class background, hardworking. My parents were extremely hardworking and they valued education, but getting to medical school, we didn't have a clue basically, and filling out the UCAS application as it was at the time, we had no expectations. My teachers didn't. It was very haphazard, and in fact, the way that I chose, the way I went to medical school, bizarrely, and you may think this is really weird, was where we'd been on family holidays in the UK. So we'd been on a camping holiday around Sherwood Forest in Nottingham, and
Okay.
that's why Nottingham was chosen. Sheffield, the same. Leeds. There was various other places I applied to, and that was chosen based upon just, oh, well, that seems nice. We didn't really know much about the course, didn't know what to look at, hadn't
Hmm.
attended any courses. It was, it was a real the blind leading the blind. Really, we muddled our way through basically.
Okay.
And on the background of that, just to slightly complicate things further, I wasn't particularly well. I'd been a few years prior to my GCSEs diagnosed with Crohn's disease, which is an inflammatory bowel disease. I've been really unwell, had lots of treatments, required major surgery several times. So it was battling the difficulties of my own family of not having any experience of medicine or university, my school not having any support or mechanism, background or experience I could draw on, and then my own personal issues with my health, which made it even more challenging and difficult, I guess.
Right, yeah, that sounds like a lot of things that made getting into medicine quite hard, especially if you have to deal with conditions such as Crohn's disease. And as you mentioned, for some people, they may come from a similar background where teachers don't really know what to do or what sort of things to guide when it comes to applying for medicine. But you still made it. So we're just wondering what sort of things were hard for you and what sort of things you would have liked help with when it came to applying.
Yeah, so that's a really good question as well. I mean, first I'd say that within myself, even despite everything, from my own experience of seeing doctors and nurses and healthcare professionals work, I realized that I felt strongly that I could do their job. I could do that. I reckon I felt strongly in my own mind, even as a 15, 16-year-old, that I could do it well. I could do it really well, in fact. So I was very determined and very focused, which meant that when I was poorly in my sixth form years, I would often work very unusual hours. So I might work very early into the late at night and into the morning, because I would feel knackered at other times during the day and need to have a sleep or lie down or whatever, because I really wasn't good with my stomach and exhausted and anemic and so on and so forth. So there was a determination there without question. But once getting into medical school, that it was really hard. And that nobody's going to tell me that anybody finds medical school easy. But one of the hardest things I found, and maybe other people find as well, is that for somebody coming from my background, I felt really lucky to be there. I was like, God, I've got to medical school. I can't believe that. Whereas I was actually, and my wife tells a very similar story actually, because she's from a similar background. But other people that were there were clearly from, and it's not their fault at all. Lucky them, but with very privileged backgrounds, and mums and dads were doctors, and they got a lot of insight from skills and support. So to them, being at medical school wasn't a huge achievement. It was almost an expectation, and they, it came across almost like they felt entitled. Of course, I would have got to medical school, and there was already an expectation that they would get through medical school without any problems at all. Whereas my wife and I, for example, knew that or felt a bit like imposters in some way, that we really needed to knuckle down, work hard. We had to focus. We had to dedicate everything we could to getting through, and so we were probably a little bit more uptight about it, really, and we had to do 3 jobs to earn extra money, because money was tight. The tuition fees weren't as much then in those days, but equally the funding wasn't as much. The grants weren't as much, so we had to make up the shortfalls and holidays and do extra jobs. We also, during term times, worked various jobs. So we didn't feel, to a certain extent, as though we could do what some of our more privileged colleagues, again, not their fault, could, over the summer holidays, go to wonderful holidays, or relax and do whatever they wanted, or go skiing in the winter, which lots of people seem to be doing, but we couldn't do. So it was hard in many respects, because there was almost it was hard full stop, but then it was hard with health, but then it was also hard with, dealing with the other conflicts and expectations, and how, being surrounded by people that were a lot more privileged and possibly geared up to, actually, this is, of course I'm going to make it. They had that belief, whereas we were trying to build that belief.
See, so would you say, coming from your background, it might be advantageous to you as you had this drive to succeed?
I think, Syed, it's difficult. I think it would be difficult for me to frame it as an advantage.
Yeah.
I think that would be very difficult for me to frame it as an advantage. I think my wife would agree from her background. I think what it did do was meant that we had a real fire in our belly, if that's a phrase you're familiar with,
Yeah.
and determination that we were going to do it. We were going to pass our exams, we were going to get through, and nobody was going to stop us. And to a certain extent, it probably possibly comes across a bit like you got a bit of a chip on your shoulder. I'm going to do better than those that are a bit more privileged than I. And that possibly gave a little bit of extra determination.
Mhm.
So in that way, possibly an advantage, but possibly nothing compensated for the privilege that colleagues, because they are now colleagues, they're fellow doctors as well,
Yeah.
had. There's a video on YouTube at the moment where you see people starting at a starting line, and there's a teacher at the end of the race, a running race, that says take several steps forward if you've never had to deal with this, you've never had to deal with that. And that race ended up being that you had people that were still on the starting line, where there was other people that had got a 20, 30 meter advantage, and they were supposed to get to the finish line at the same time. And that's often how we felt, that we were not only having to do what other people had to do, but we're also having to work that little bit extra harder
Yeah.
to get to that finishing line. And I think that's why we didn't feel like we had an advantage. We had the determination, but we didn't have the advantage.
I see.
Yeah, I think there's no doubt that things like that frame your personality, your character. But if I could have a time machine and go back, Bev and I, my wife, I think we would like to go back and clearly not have to work as hard, not have to do all those jobs just to pay rent and make sure that we were able to do things. And books are very expensive in those days at medical school as well, and
Oh, yes.
computers and things. So yeah, we would have had it another way. And we've got 3 daughters of our own, and God forbid if they wanted to become doctors in the future, we wouldn't want them to have it as hard, clearly.
Of
And
course.
hopefully, given our background, they won't, if that's what they chose to do.
Okay. Yeah. Well, that makes sense. And so moving on, I just wanted to ask you, you mentioned your 3 jobs. Just out of curiosity, what were those jobs?
So we had 2 jobs that we worked in GP practices,
Okay.
where we were summarizing notes. So I've counted that as one job, but we also worked for a charity called IMPS, the Injury Minimisation Programme for Schools, which was a program that ran through the Queen's Medical Centre in Nottingham, the hospital, teaching school children how to do basic life support. And our final job, which we did intermittently, was we worked for a eye surgeon who were helping doing portering for him. So
Okay.
so we did a variety of things. They were all kind
Yeah.
of medically related in some way, but it meant that our weekends were taken up by doing things like that. In between lectures, we may go and do the charity work. So it was a lot of organisation of fitting things around,
Yeah.
which made it quite busy for us.
I think that's very respectable, because if I try to imagine myself working 3 part-time jobs whilst doing medical school, I think I might just go crazy, because there isn't that much time. So the fact that you managed to do that is, a huge achievement. And yeah, it's just I'm lost for words, really, because I can't imagine myself doing that. I guess by being in that position and not really having a choice, you really just had to do what you had to do and just did that work. So yeah, props to you. So with all of the experience you have, do you have any tips for aspiring students who want to go into medicine or become doctors?
Yeah, no, I mean, I wouldn't want to use my story to put people off. I think it's crucially important that people from mine and my wife's background do go to medical school and represent people from diverse backgrounds. That's essential. My tips would be, because we have had some support along the way, some mentors that have given us extra support, like at medical school with the charity that we worked for. We had some nice people and nice doctors. Interesting one doctor called Dr. Smith, by chance, who was very supportive and knew our situation. That helped us out. So find mentors and support if you can.
Yeah.
Very happy to be a mentor, and my wife would be as well to people that need extra support. Believe in yourself, and don't get psyched out by very privileged people that you may meet. It's not their fault. They often don't realize how privileged they are. You realize how privileged they are. They often don't, but it's not their fault. And work with those people. Accept that you're going to meet lots of people from different backgrounds.
Yeah.
Don't have imposter syndrome. You deserve to be there. You absolutely deserve to be there. Remember, you're sitting the same exams. You've sat the same A levels often. You have competed to get there despite starting 20 meters behind these people. So you're an impressive person to be there. And believe in yourself. Belief is everything. There were times where Bev and I think, nearly stopped believing in ourselves, and doubt creeps into your mind. Always believe that you can do it and keep your focus.
Sure, that's amazing advice, and I think students will definitely benefit from this. During medical school, can you remember any time when it was really, really challenging, and what you did in this situation?
Yeah, God, I mean, there was a few occasions really. I think for me, in terms of examinations at Nottingham, probably the first and second term of the first year of medical school were the hardest, and I'll explain why. The reason is that it was a real culture shock. First of all, you were surrounded by people that were from, as I say, very privileged backgrounds. We were given assignments where we were exposed to things that I'd certainly never experienced. For example, I remember walking into one of the laboratories for an assignment we had to do, and I'd never seen anything like it. But the guy sat next to me, said, "This is what my school was like." It was a completely new world to me. So, so that first year, particularly with the exams, preparing, doing assignment, getting used to these amazing new things alongside people that was their normal already for them, felt like there was a huge kind of adaptation that needed to go on. Plus, there was huge pressure, and you've got all of these people, highly intelligent people that have scored really well, all crammed in together, in halls of residence, studying their hardest. You're away from your family. It was a real struggle to try and keep your focus and not get psyched out by all these other people stressing out. And so that was really hard. And the way that we overcame it was my wife and I, were boyfriend and girlfriend at that point, teamed up together and tried to work together, support each other. And I think if people are able to do that in medical school, that's a really helpful way of trying to get through and rationalize things that need to be done and don't need to be done, and work through the difficult times.
Is this a career you'd recommend to other people? And if you do, why?
So, I mean, you would expect me to say this, but I think gastroenterology is by far the best specialty out there. And the reason for that is quite straightforward, really. Whereas I guess cardiology, you've got a single organ that goes lub-dub, lub-dub, lub-dub. I'm obviously simplifying things massively there and deliberately being provocative. But with gastroenterology, you've got the esophagus, you've got the stomach, you've got the small bowel, the large bowel, you've got the liver, the biliary tree, the pancreas. You've got all of these different organs and diversity of conditions that you can have, and the presentations and the different problems and diagnoses you can form and investigations, the different surgeons and nurses and histopathologists and radiologists and dietitians, and so many different people you have to work with. You look after very acute problems such as acute varicose bleeding from somebody that's hemorrhaging, and you need to do something to save their life, versus chronic long-term conditions like Crohn's disease or inflammatory bowel disease. You get to do procedures And some of the procedures border on surgical procedures. So whereas at the same time you have the knowledge of a medical doctor, you know how the body works and what medicines to give to people to try and make them better. So it's very diverse. It's acute and chronic. It's exciting. Every day is different. For me, I guess to a certain extent, my decision was swayed by my own personal experience of having Crohn's disease. But it's a fantastic job, and I would strongly recommend it to anybody. And in fact, I always encourage our medical students in Liverpool to do gastroenterology.
Okay, yeah. Well, the way you've put it there makes me want to do it as well. Especially,
There you go then.
especially for variation you've mentioned. It sounds quite good, and yeah, I never thought about it in that way. The esophagus, the duodenum, the liver, but there is a lot to it. So yeah, a lot to get your hands into, I guess.
Yeah.
So a little bit more about your job now. Just wondering what a normal day in the life is like for you. Just a short overview.
Yep. So, I mean, obviously at the moment with the COVID-19 pandemic, all jobs have changed, but pre-pandemic, my normal week would be on Mondays. I would have some administration time as a consultant. This is to sort out patient letters, do work for clinics, do MDT work. I would have a nutrition MDT, what we call a feeding issues MDT, then a radiology meeting and a histopathology meeting. Then I'd have a clinic, an outpatient clinic where I'd see my general gastroenterology patients. On a Tuesday, I would have a nutrition ward round, followed by an endoscopy list. On a Wednesday, I would have a transition clinic where we look after the young people coming from Alderhay to the Royal Liverpool, and then an endoscopy list. A Thursday, you would then have a nutrition MDT and ward round, followed by a inflammatory bowel disease clinic. And on Friday, we would have our big IBD meeting, our MDT.
Mm-hmm.
And then I would have a specialist, what we call home parental nutrition clinic on that day. And then Friday afternoon would be administration and, wrapping up before the weekend. And if you were on call, you would be covering the wards or endoscopy at the weekend, looking after patients and doing ward rounds and dealing with emergencies. So very busy, very hectic. I also had on alternate weeks some time for research that was built into my timetable. So very busy though overall.
It sounds very busy. Just wondering, like, is it like 12-hour shifts or longer for you then?
Yeah, I mean that's the thing that possibly people don't realize is that when you do become a consultant, we're definitely not on the golf course. I'm certainly not. On a typical week pre-COVID, I would probably, because I'm an early bird, I would probably try and aim to get into work for around 7, half 7 in the morning, and then the idea being that I could get in early, do a lot of things that I needed to do, so that I am able to leave around 5, half 5 to get home and see my children before bedtime. Sometimes, however, when you're on call, if there's been a particularly bad or busy day, that can be extended out. But often my wife and I, she's in the same situation, have our laptops out at night time, signing off letters, doing letters, lots of different things, doing presentations, doing stuff for medical students, many different things really. So it never ends really. It's busy, it's enjoyable, but it is incredibly busy.
As long as you enjoy it, I guess, does that feel less like work and more like something you enjoy?
Yeah, I mean, as with everything where doctors are human water and you feel elated and everything's great, on difficult days, which everybody has, then obviously you can feel quite different. So, but it is a satisfying job and I'm certainly never bored.
That's perfect. That's something you'll always want from your job. So that's definitely good to hear. And once again, I might be considering gastroenterology now. So
If you do, visit the British Society of Gastroenterology website, and there's a course called the Taster Course in Gastroenterology, which is a great course, and it gives people like yourself insight into what it's like to be a gastroenterologist.
perfect. I'll write it down right now.
Okay.
So let me just
Okay.
now a little bit more about your job. Last few questions. But we're just wondering if you were to say what are the advantages and disadvantages of your job?
So I guess I've touched on already kind of advantages in that it's very diverse. You get to do procedural skills. You look after acute problems and chronic problems. You never get bored. You work with lots of different health professionals. And obviously in adult medicine, I can work with people as young as 14, 15 years old in transition clinic all the way up to 100 and odd years old in some cases. So there are advantages. Disadvantages are it's very busy. I can't say it's not. There's, lots of referrals, lots of demands. There's lots of pressure at times. Doing some of the procedures can be very pressurized because you can potentially do harm to patient. There's a lot of very sick patients, some patients that need intensive care, some people that need lots of support and empathy if they've, had serious issues where they've lost parts of their bowel, or they need major surgery, for example, or they need very strong medication. The on-calls can mean that we have to go into hospital in the middle of the night. So it's extremely busy. That said, generally speaking, I think most people would agree that the positives outweigh the negatives, which is why we carry on, of course.
That's great. Yeah, I think that was very useful for many of us who may be considering some specialty into gastroenterology or just to work as a doctor in general. It does give a good insight into what things you need to consider before becoming a doctor and realizing the stresses of what that brings. And just one final question for you, and it's to do with gastroenterology, and it would be, do you have any tips for aspiring gastroenterologists?
Okay. Yeah, I've got a few. If you are interested in doing gastroenterology, go for it. Don't be put off by the prospect of having to do some general medicine. You have to have general medicine knowledge in most things, medical at least, and it's very useful, and you use it every day in your practice. Get experience early. So if you get F1 or F2 jobs that doesn't involve gastroenterology, see if you could swap into jobs if you know that you're interested for that in relation to that. If you can't, try and take some time out to do some taster days or taster weeks with gastro teams. Attend the taster course in gastroenterology, which run by the British Society of Gastroenterology. That's a big tip. Approach your consultant gastroenterologist and the registrars and say, have you got any projects or audits or papers or case reports you want to write up? Or if you find an interesting case of your own or audit or project you want to do, approach people and say, could you help me write this up and try and get it published? Always really good and motivates people, good for your CV, good for applications. Don't be put off by the long training. If you're interested in research, there's so many different opportunities. So, look out for opportunities. Look out for quality improvement projects. If you're interested and you think you're going to be really interested in endoscopy, go down to the endoscopy department, introduce yourself, say, could you watch a few lists, show that you're interested. People generally respond well to enthusiasm. So the most important thing is to keep your focus. If that's what you really want to do, go for it. Don't let anybody put you off. You might get knockbacks, of course, but if you do, just kind of brush yourself off and then try and pick yourself up and go again. But don't give up if that's really what you want to do.